is an Evergreen Media Network studio production.
Honestly, without Treasure Coast Community Health, I think we'd be a much poorer community in terms of our health. We're always striving to fill the gap for everyone in the community, rich or poor.
Good afternoon and welcome to Community Conversations. My name is Vicki Soule and I am the CEO of Treasure Coast Community Health. Now, normally we talk about things that are related to health, and today is no exception. I can always weave it back into health in some way. But I was telling my guests that maybe we should title this as Thinking Outside of the Box, because typically our services are in outpatient facilities. The more the merrier to make it convenient for you. We have 8 locations around the county, and we partner with a lot of different individuals. And through one of those partnerships, we were invited to form a 25-year commitment with 3 other partners in a community school. And that community school is Dodgertown Elementary. It is one of our Title I schools, and we're so proud that as a school district we now have an A grade. So there's been a lot of fantastic work through all of the schools, whether they're elementary, middle school, or high school. Dodgertown Elementary serves children from pre-K all the way through 5th grade, and we've had the opportunity to have an unusual configuration as part of our health role there. And so one of my guests today is Ladonna Corbin. She is our wellness coordinator, and typically the wellness coordinator is hired by the community school group, but we have donated Ladonna's time to really act as a liaison and educator so that she is just as comfortable in the school system as in Treasure Coast Community Health Services and vice versa. And after several years of looking to see how we could enhance behavioral health adjustments at the school, as everyone knows, mental health problems have just soared since the pandemic. And so mental health counselors are in very, very short supply. But one day, I was able to open up my mind a little bit in terms of other folks that are offering services to children who are struggling through difficult encounters. And I came upon Katie. Katie, welcome.
Hi.
We're so glad you're here. Now, tell us your official title.
Sure. My official title is a Certified Child Life Specialist, or some people know it as CCLS.
And where do you normally practice with
normally
children?
Practice in children's hospitals, whether they're freestanding or sometimes part of an adult hospital.
And what do you normally do in those more traditional CCLS roles?
Sure. So we help with like the psychosocial and coping aspect of being in the hospital. So we wear many hats. So that can range from prepping a kiddo to go into surgery to talking about different diagnoses.
Oftentimes early cancers are traumatic to children.
Rehab, traumatic brain injuries. We can work in the ICUs, the PICU, pediatric ICU, or the NICU, neonatal. We can also help with grief and bereavement, that legacy building, so end-of-life support. Another big hat we wear is sibling support. They're kind of the left out, because everything's solely focused on the patient, where the siblings sometimes are left at home for a long time. Parents aren't there. They're staying with another caregiver. So focusing on the sibling as well, too, and then supporting the family-centered care as well.
So a lot of interactions directly with the child, but also with a whole mindset about how the family adds to the support of that child.
Sure.
So that's a perfect opportunity for you to work with the children at Dodgertown, who often have unusual family situations where they have had problems in the community or in school. Often it expresses in school.
Yes.
So how long have you been doing this now, officially?
Since January, so going on about, I guess, about 3 months now.
So you're still a newbie,
yes,
sort
ma'am.
of.
Yes.
And Ladonna, you're here as her support person?
Yes.
Okay,
Yes,
so you've been with Dodgertown now, is this your third year?
Going on my fourth year.
Wow.
Yep.
Time flies when we're having
Yep,
fun.
it is.
So tell us a little bit about your role, what it started with, and maybe now that Katie's here, how it's evolving.
So my role basically as the wellness coordinator is to connect our families with Treasure Coast Community Health. Not only do we service the students at Dodgertown, we service their siblings and we service the whole entire family. So if there's a child that's in need of any type of service and they do not have a provider, I connect the services with Treasure Coast Community Health. We have the best home team at the Gifford facility. We do warm handoffs with parents. We just don't send them to the facility. We actually contact Sophia. Sophia welcomes them in with that warm handoff.
As our site manager there.
As a site manager, and the whole team just embraced Dodgertown.
But you said a very important thing, and I want to repeat it. If they don't already have a pediatrician. So if they do have a pediatrician, you're still liaisoning for that child to ensure that they're seen as soon as they need to be seen.
Correct.
And involving the parents.
Correct.
Okay.
We had another, just a recent incident to where we had a child that has a provider here in Indian River County, but the parent was unable to get them in for the shot records. So we were getting ready to exclude the child out of class, out of school.
Not a good thing.
No, not at all, because it takes so much to get them back in. So the nurse reached out to me and I was like, okay, I can help. I contacted the parent. I let the parent know we're not trying to switch providers.
Right.
I can just get you into Treasure Coast Community Health right now. I turned that off.
Well, it's a sweet little
to connect them with Sophia to be able to get the shot records.
Okay.
So what was missing was they transitioned from New York. And New York takes a long time sending their records. So our nurse had to work with New York and also with the parents to try to get the shot records here, not to duplicate the shots. So they worked within all measures not to give those shots again when we knew that they were already given to the child. So little things like that is how I help parents connect. The parent was very grateful for the help because she had been fighting this for a couple months.
Oh, goodness.
Yeah.
That is a long time.
It is.
Because you want everybody to just settle in and this is your new life and things are going smooth. But a couple of months battle over shot records is tough.
It's terrible.
So thank you. Thank you very much for all you're doing.
Thank you.
So in working with the nurse there, you mentioned her as well. Every school has a school nurse. So
Correct.
why is your role as a health access person different from the nurse?
It's not different. It's more of a support. We support each other. We have the local health department that comes out and they do mandated testing and screening for kindergartens, first and third graders.
Right.
So the second, fourth, and fifth graders are really what we kind of home in on.
Okay.
To identify any hearing issues, any seeing issues, any behavior issues. So we work as a team. When children are identified or there's any issues or concerns with them, she comes to me or I go to her and say, hey, listen, we've been trying to get this child in for like the last 2 weeks. What's going on? So we kind of tag team on parents to say, hey, listen, this has to be done. It's not optional. So we're more of a support system, but my role cannot be successful without her. She is absolutely amazing. We work hand in hand, and when we have issues, we tackle them together. We resolve them together. We work absolutely. I just couldn't do what I do without her there.
Well, and she's very focused in terms of health issues, where I know from prior conversations with you that you kind of expand that box a little bit, like transportation, like things that a nurse would not be
typically
at Target buying things for children that they need.
Correct. We do. When I tell you Treasure Coast sponsors a lot of families, and when you said that buying items from Target, we had a situation with the children. They were in transition of moving from one location to another, and they were on air mattresses. And one of the girls, the two of the girls that was on the air mattress, it was letting down at nighttime. So the mom would just let them sleep over in her bed. So you can imagine 3 people inside of a full-size bed. When that nurse wrote that referral for me, I instantly knew what it was that I had to do, and that was to get to the store, get these air mattresses, and be able to give that parent a peace of mind.
And the children a restful night.
Yes,
because
they are.
Children that are distracted through lack of sleep, through a dental issue that they've told mom about, but, out of sight, out of mind. It's not mom's mouth.
Correct.
And they don't want to pester mom.
Correct.
They know that mom or dad are struggling on their own 24-hour cycle. So you actually are sort of a family advocate
I am.
relative to health.
When you look at a family that's in need, you look at the whole family. And until you have a healthy whole family, you don't have a healthy family. So you start with the parents. We have to make sure that the parents' needs are being met also, because the parents then are being successful providers for the children. So once we can keep it as a whole family in a unit, that's what we aim for. We don't do one without the other. So in parents right now, since COVID and going back to work in the workforce, roles have switched. A lot of parents are not nurturers now, they're providers, because they're trying to get out to be able to provide for the family. So I give them little tips and secrets and stuff with staying focused and staying healthy and stuff, and always reminding them, you have to remember you, because if you're not here, they don't have anyone. So that Absolutely. Is again, I advocate for whole families, and I really advocate now with women. We do a lot for everyone else, and we forget about us. So when we have our face meetings and stuff and our engagements with our families, I always do something to remind the parents, you have to take care of self first too.
And you help that by calling parents and saying, I'd like to take Sally, Jasmine, whomever, over to be seen by the pediatrician, but if you would be available in half an hour, you don't have to leave work. We can have you call in like a telehealth.
Correct.
Okay.
And that important piece, that transportation piece has been phenomenal for Dodgertown, because a lot of our parents are starting new jobs, can't really take off from work, can't afford to miss a day or a couple hours to transport a child. So we call them field trips. We give them the parents the permission slips. They sign up for the field trip. Once they sign up for the field trip, we take the child to the doctor's office. Once they come back, or once they're in the doctor's office, the doctor is able to telehealth in with the parent.
Okay. Once they get a good history from the parent.
Exactly. Especially if they're not our patient, we're supposed to talk with the parents and stuff. So they telehealth in with the doctor. The doctor tells them everything that they're doing, and also following up with their provider if they have a provider, and being able to give them that service. So that transportation piece has been a lifesaver with a lot of parents.
I can hear the phone ringing next. Why doesn't my school have?
Exactly.
Well, to that end, we're going to take a very short break, and then we're going to come back to Katie, okay? I didn't mean to ignore you, but she really helped fill in a lot of why and what and how. So we'll be right back. Take a short intermission for a word from our sponsors, and stay tuned. Don't leave. Treasure Coast Community Health in-house pharmacies have the lowest prices in Indian River County, even lower than big box pharmacies. Taking your medication as prescribed leads to better health. Affordable medicine makes it easier. Treasure Coast Community Health patients can pick up medicine as they leave the office or use free delivery and mail order services. Pharmacists are always available to answer questions. Switch to TCCH pharmacies. Save money, stay healthy. 772-257-8224 and ask about our price match.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens and Bollywood. We specialize in fire pits, outdoor rugs, umbrellas, and replacement cushions. Sunshine Furniture, 1295 US 1 in the Publix Plaza, Vero Beach. Family owned and operated since 1991. Don't forget to visit our outlet store directly across the street, filled with lots of name brand closeouts and sale items. Visit our website at sunshinefurniturecasual.com.
Sunshine Furniture, the best in every way. Ooh, have a sunshine day. Sunshine.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. EZ for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health. And of course, I have to plug just a little bit more. We are taking new patients. We provide primary care through a variety of different locations. We now have a mobile that's going out so that if it's more convenient for you to check our Facebook page or our website to see where we're going to be. It's a walk-in service. We want everyone to get the health care they need when they need it as close to home as possible. So again, if you are one of those unfortunate few that have not been able to continue your relationship with your previous physician or nurse practitioner because of retirement or other reasons, please give us a call. We will get you in very quickly compared to the norm in Indian River County right now. So that number is 257-8224. But again, I'm here today not to talk about our services, but rather our extended services through the school system. Very important that we get our children off to a great and healthy start. We work a lot with the Moonshot Community Action Network, trying to ensure that parents understand that their children from birth on are little sponges that see what we do and learn very quickly in the most part. But we do have some special kids in every school across the United States who are needing a little bit more in resources. And a lot of emphasis has been on mental health and then behavioral health being how they exhibit the healthiness of their brain. And so, Katie, you've been here at Dodgertown now for 3 months, working with our children who come from all different modes of life, from pre-K all the way up through 5th grade, which all by itself for every kid is quite a parameter. So are you challenged?
Yes, definitely challenged. Yes.
When are you, you mentioned during the break that you're seeing about a dozen kids now. And what age range is, I don't want to say the most popular, but what's the largest age that you're in terms of group size?
Like how many kids I'm seeing at a time, or just their,
well,
like,
that's the second question.
Okay.
I was really thinking in terms of age. Are you seeing more kindergarten, 1st grade, or more towards that 4th and 5th grade, or
third
somewhere in
graders,
between?
Actually,
Third
right
graders.
In between. Yeah,
Wow.
Third graders are my most needy, or they've really identified that they have the most needs in the classroom. So
That's
it's
very
my third
interesting.
graders.
I know that 3rd grade is really our stretch goal through MCAN to ensure that the children can read on grade level by the end of 3rd grade. We're about halfway through, maybe a little bit better. Yeah. Because after that, the children are really dependent on their own reading ability then to learn. And so I would imagine that's a lot of pressure for a 3rd grader.
Yeah, reading. This morning I was in the classroom with 3 of my kiddos and we were doing math. And everything is way different than when I went to school or when we all went to school. Everything's on the computer or the laptop. So kind of helping them to focus on that task that they're doing, that question, breaking that question down. The classroom, I'll be honest, is very distracting because, there's just noise. Some of the kids are having it read the question to them. So you have kids that are sensory.
20 kids.
Right. You have 20 kids, and then I have like my group of 3 this morning, and just sensory stuff. Like you're hearing the other kid listening to that, or kids are getting up, washing their hands, getting a drink,
dropping pencils,
or tapping
pencils.
My goal was to keep them focused, but even those 3 kids were all in different levels as well, needing different support. One's on this question, one's on that question. So kind of just helping them. Today was my first day doing that, so we're pushing into the classroom. But I also pulled these kiddos out into my play space as well, too, which they absolutely love because we don't have all those sensory things in there. It's a quiet room. I can have the lights down low. I've done just like general play. So the kids are able I have lots of toys in there. They can just have a play session, which I'm realizing in school they're not able to do as much play. Yeah.
But play is a method to actually be able to let the child relax enough to share.
Yes.
I just want to make sure I don't get calls saying,
My child's playing in school.
Right. You're paying this lady to be a play assistant?
Right.
No. It's really about trying to get the child to open up to you about.
Yeah, I mean, I can talk about an example about 2 weeks ago where I had one little girl in there, actually two of my kiddos in there, and one was playing on their own and she was playing on her own, and she was identifying like sort of anger release through her play. So play is the work of kids, right? It's the language of kids. My biggest thing as a child specialist is we use play every single day, but kids don't sit down and have a conversation with you, right? They play through that. So she was kind of showing a little bit of aggression through that. I could hear some of the words maybe that she was hearing from adults at home or school, and she was processing that through the play. So, and I didn't even have to ask her any questions, right? I'm just watching her play through that. And so that was really interesting for me because I was like, wow. And then I ended up telling the teacher, hey, this is what I saw. Is this coming out in the classroom? No, because this is more individualized. Sorry.
Okay.
So that was interesting. But play is really important, and I'm identifying kids that need that expression, that therapeutic release.
Sure.
So that's what's really nice about it.
And again, I want to say you just started this journey.
Yes.
So just like adults, children have to have trust. They have to develop a relationship with you. So I would imagine as more comes out with any of the children, you'll be having more conversations both with them and with the adults in their lives, whether it's their family, supportive teachers, and so forth.
Yes. I mean, if there's something identified that I would kind of trigger to be like, that doesn't really sound right, by reaching out to Ladonna, she's very familiar with a lot of the parents, helping me with that way, or is it something that I need to identify with the teacher? Because you want to make sure it's safe, too. There's nothing going on that's kind of triggering my red flag of like, is there something at home or something with the psychosocial that makes me feel uneasy or uncomfortable? But the kids, even today, were like, Miss Katie, are you going to take me to your space, after lunch today?
Please.
Because they just love it. They love it there.
Well, it's individualized attention as well. And for many of the children that come from bigger families or a hardworking family where they don't spend a lot of time with parents because they can't, that's special time.
Or even just the toys. They're like, we don't have dinosaurs or magnet tiles at home, Katie, and so that's really special. Or,
Do you have to frisk them so it doesn't go home in pockets?
And sometimes.
I'm kidding. I'm kidding.
But we have like a special, they can get something like Model Magic or a Play-Doh or a stress ball, but it's hard because they're not really supposed to have that in the classroom. So it's kind of like, hey, do you want to keep it in my space, or next time, are you going to keep it in your pocket? Or are you going to put it in your backpack?
So it's a motivational tool as well.
Yes.
Okay.
So for good behavior too as well with me. So
well,
fidget.
I'm really impressed. I think that this is certainly, aside from your title, what we hope all of our children who are struggling in school get that opportunity to work with an adult like you, whether you're a mental health therapist or a licensed clinical social worker or a certified life specialist. And sometimes I wish I had one. So thank you both very much. Anything you want to add as we wrap up the show?
We are open for any visits for if anyone out there would like to come out to Dodgertown Elementary and see what a community partnership is all about. You're welcome to come out, set an appointment, and just take a tour.
That's a great idea.
Be a part of our family.
And actually, it is a family type thing in that parents and extended family and even those that have no children in the school are invited to participate and advise the school in their neighborhood in terms of things that would be better and or volunteer for events and things that we're doing at the school. So
we love our community pillars.
Yes. And Katie, we love having you there. So 4 days a week beats 0 days a week. She was very concerned at the beginning. I can't work 5 days a week with you. I already have a commitment. It's okay. We're loving it.
Make it work.
We're loving it. We make it work. So again, thank you for joining us in this unusual community conversation. It's always fresh, different, unrehearsed, and hopefully very helpful to you to know what's going on in your community. So join us next week and have a wonderful evening. Bye-bye.